It's not just about what it looks like, it's what does it feel like. We all love going to a glamorous hotel. Sometimes we just want to go home. We don't want somebody to want to go back somewhere. We want them to be comfortable here.
Person-centred care is paramount for who we are. Some residents are in care for quite a while and they become part of your family, and it sounds quite a cliche, but it is so true. You don't get hardened to losing people, you just know that it's an honour to do that last part of their journey.
Thank you for being here with me.
Peninsula started 23 years ago. My father had had a corporate career. He then took early retirement and moved back to Devon, where he'd grown up, and within 12 months bought 5 homes. My father's values were honesty, integrity, and family. Are you proud of what you're doing? Are you proud of the care that you're delivering? And are people happy? We have always been about care and connection. So every decision I make is about, how does this impact the resident? How does it impact the team? Their bedrooms are their space. I love a room that is full of personality, memories, their pictures, their history. We've used electronic care plans since 2017. We were quite an early adopter. But over time, you realise that you've got data in there. What are you doing with it? We needed the structure, the professionalism, so that we can ensure that we remain on the right side of our regulator, that we have an oversight on training. We needed something that was easy for the team, that it would give us the data and the answers that we were looking for.
When I came to Peninsula, I didn't have the information I needed to make that judgment of whether the quality was good or not. And there wasn't oversight of all of the service easily, and it was very, very time consuming. I then asked the board if we could invest in Radar because it would speed up that assurance process, and it's life-changing.
It's a great tool. It is so beneficial to care, and Radar Healthcare just makes you accountable for documentation, compliance, and I know that CQC really were impressed by our use of Radar Healthcare. When CQC asks you questions, you can just direct them straight to Radar Healthcare and prove that you're delivering as you should be.
It's the best investment that we could make to get that confidence so quickly. Had we not had Radar Healthcare and been able to evidence all of the work that we were doing at Capelia, I don't think we would have got a good rating. Radar pushes your team to do the right thing at the right time, and you can see very quickly if they haven't. And we had really good engagement. They took to it really, really quickly. People were really surprised about how easy it was, and because they're all a very competitive bunch, they liked the fact that they got a score and they could see that they were improving.
It's all in one place for your infections, your wounds, the follow-up and the reviews and things like that. They're all done in a timely manner. When the inspectors arrive, we know that we're ready to show them exactly what we do.
Each of us use the platform differently, so I will just have an oversight on lots of different areas. Nick, our Director of Operations, does really deep dives into a number of things that are linked to our quality framework. Having a system like Radar Healthcare enables us to have that oversight. If I was to call them every time I wanted to check something, they would never get anything done. So I think it's giving them the space. We've got a sponsorship license. I'm ultimately the license holder. You hear that somebody who's lost their license because they didn't do something, but you can just keep going back in and just checking. We're all human, errors can happen, so it gives me that ability to check, make my way through the dashboards quickly and easily.
I've gone from having all of these different Excel spreadsheets, all of these different bits of paper that have been scanned in, and it could take you, 2 days to do a CQC response, to now I can just go in, press a button, and within a couple of minutes, I've got all of the information that I need. It is life-changing. You can focus on what we're actually here for, which is improving the lives of our residents.
Peninsula gets behind people to develop them. The person-centred care that we offer is amazing. I want people of this age range to live well, be listened to. It's not an institution, it is a second home for everybody, staff, families, but most importantly the residents, yeah.
Fundamentally, it's about ensuring that we have quality of care that we want, that we can be proud of what we're delivering. We've got so much knowledge now with Radar Healthcare. I can already see that it's paid off for us.
Thank you.